Hi, everyone. Thanks so much for joining. I'm Sierra Alvarez Valle. I'm a senior policy analyst at Voices for Utah Children. I'm here with my colleague, Jessie Mandel.
Hi,
An
I'm
intro.
Jessie. I'm Jessie Mandel. I'm a senior health policy analyst and deputy director here at Voices.
Yeah, and we're here to talk a little bit about the legislative session and give a brief update about the bills that we worked on or we supported that passed, and then also a few that we didn't support, and just a couple of updates. So I'll start first with our policies related to immigrant families. There are a number of legislations or a couple of legislations that passed that were good for immigrant families. A couple that had to do with the driving license division. The first being that HB 216 that was sponsored by Senator Escamilla that will allow for greater language access to those with limited English proficiencies to obtain a driver's license. So this makes it so that the multicultural office works directly with the Department of Transportation to find the 5 most commonly used languages aside from English and be able to translate tests for those people who need it when they are trying to get a driving license. We're excited about this bill and excited that there's greater language access. And we're also really hopeful that we can go back next year or the years to follow to expand the services to people who are seeking a limited term driver's license or a driving privilege, because we know that folks often have these same language barriers as people who are seeking a driver's license. The second bill that I wanted to talk about is HB 222, which is a bill that would reduce the cost of driving privilege cards that was sponsored by Representative Robertson. There was just like issues in cost, and it was costing $52 for someone to get a driving privilege card, and that cost is going to be reduced to $32 for a new privilege card and $22 for a renewal. We know cost burdens can be really heavy on families, and this will make it safer for folks to be able to get their driving privilege. And because it's an annual renewal, they'll be able to renew it every single year without that worry about how much cost that it's going to be for them and their families, since $50 can be a lot for low income families. The third bill that I wanted to talk about is relating to refugee and immigrant students. This bill was sponsored by Representative Johnson, and thanks to the work of our friends at the International Rescue Committee, the IRC, we love and support this bill. It improves the enrollment process for immigrant and refugee students by addressing challenges that they face when they are trying to recognize their age, when they immigrate or they get refugee status here in the States, when they're trying to get interpretation of their prior language in their country of origin, and adding clarity to the extension of conditional enrollment periods. So there's a conditional enrollment period when someone is still receiving their vaccines but can enroll. And so this clarifies this language. So it's broad, it's the same for all kids who are immigrants, refugees, or moving to the States. So it's a really good bill, and we're really excited that this enrollment process will be much easier for immigrant and refugee students. Now we're going to talk a little bit about our healthcare or health access related bills. I'm going to talk about our community health worker certification process by Senator Escamilla, and then we're going to talk about our Cover All Kids bill, and then Jessie will finish off by sharing a couple of other health related bills. So the first one that we worked on is a community health worker certification process that provides an optional certification program for community health workers to be able to get a certification, which is really awesome. For those of you who might not know, community health workers are frontline public health ambassadors, health educators. They have trust and close connections to their community that allows them to serve, connect, and empower their community members, whether they're communities of color, those in rural communities, people facing poverty, people with disabilities, people who are facing homelessness, and more. And so these are really important health educators, ambassadors in our community, and this bill this certification, optional certification, allows for greater professional recognition, opens doors for more funding opportunities, and also importantly creates a more unified workforce. So we're really excited about this bill and hoping to continue working on community health worker legislation in the future to create just more sustainable funding and opportunities for these frontline public health workers. So with that, I'll pass it to Jessie to talk a little bit about Cover All Kids.
Thanks. Well, I'll start and then Sarah can jump in. As many of you know, Voices for Utah Children, this is one of our top priority issues this year, was coverage for all kids. And it's a priority bill for also the 100% Kids Coverage Coalition, which involves many amazing community members and partners across the state. Senator Escamilla supported and sponsored and championed Senate Bill 185 this year, which would ensure that all children are able to access affordable health coverage and keep their coverage. And it would do so by ensuring all income eligible kids are able to enroll in Medicaid and CHIP regardless of their immigration status. And then it would also have restored funding for continuous eligibility, which was cut during the 2020 session. So it was a great bill. There was a lot of work happening behind the scenes. Senator Escamilla was just tremendous champion for this bill. It got through the Senate and with broad support, broad bipartisan support, and made it over to the House, but did not make it to the floor for a vote on the House. However, we got farther than we ever, this was even farther than we made it last year, and had a lot of powerful conversations with so many and are really encouraged for the progress of this bill next year. Sirak, is there anything you want to say about this bill?
Yeah, I think you said it really well, and we're so excited to continue working on this bill next year. And we're also really grateful to all of the support that we received both in the Senate side and in the House side when we had conversations with legislators about this bill. And of course, to our floor sponsor, Representative Schultz, we're really grateful for his support and continued support next year for this bill to ensure that all kids are have health coverage. We know that health coverage isn't the end all, but for kids, it's a really important foundation to receive, to be able to access the healthcare that they need and help, kids in school be able to thrive and come to school ready to learn. So we're excited to work on this next year and really grateful to our legislators who supported and all of our partners and coalition members this year who also took action during the legislative session and supported.
Yes, thanks. Yeah, so true. So many amazing people who shared their story on this bill. We've mentioned this so many times, but Utah has one of the highest rates of uninsured children. And this bill is critical to helping all kids get coverage. This is what we need to do. So we're so excited to keep working on this, to keep working with Senator Escamilla, Representative Schultz, and so many of you. So next year we'll get across the finish line. Yay. So on to a few other bills that we were tracking and watching on the health side. Some that made it through and some that didn't, but all that we know that were really important to lift up over the course of the session. Very excited to see the Period Project bill pass with just broad support, and this is a bill that will ensure that period products will be in schools across Utah for free for students that need them. Very excited that school nursing services, Representative Harrison sponsored a bill for school nursing services that will help Utah begin to address our very alarming shortage of school nurses in schools and provided a pathway for more schools to begin to hire and keep more school nurses, which are of course vital to helping kids access services and stay healthy. Unfortunately, Representative Lesser sponsored a bill that would extend postpartum coverage in Medicaid beyond 60 days. This bill did not pass, but we were able to get some really great data and information about it that is going to help us in the future. It's going to be a priority issue in the interim so that we can begin to make sure that all people are able to get and keep prenatal and postnatal coverage. We know a lot of people actually are uninsured prenatal and postpartum, and this bill began to address that, and it's something we're going to continue to work on because that's vital, not just for pregnant people, but for kids to have a healthy start when they're able to, when the parents are covered. Finally, we do just want to mention, of course, many of you are aware that there was the bill HB 127 that did not advance. This was a bill that would have prevented many parents, denied many parents from being able to provide the medically necessary healthcare for their transgender children. This bill did not advance this year, which we are grateful for legislators for listening to the concerns of so many, including our partners over at the Utah Academy of Pediatrics chapter and many others, Quality Utah and so many others, to see this bill not advance. It was a really great thing for kids in our state. Unfortunately, a bill at the last moment, many of you are probably aware, student eligibility in interscholastic activities bill, a bill that does impact transgender girls from playing high school sports. That bill did pass at the last minute, but we're grateful to Governor Cox for his willingness to veto this bill and speaking out against the damage and harm that this bill does for so many kids and students in our state and the message that it sends. So keeping an eye on that one, and appreciate the commitment from the governor. And so we'll be looking at that one moving forward. And finally, of course, at the beginning of the session, we did see some attacks to public health, attacks to public health departments and local county officials' ability to address the pandemic and really just to step up to their public health positions in order to do what's best for individuals, kids, families across the state. You know, it already feels like so long ago that we were having that fight, but it's really important that we continue to lift up and strengthen the work that our public health departments and workforce are doing, not just during the pandemic, but throughout, because having a robust and strong public health system is good for kids and families. And so these bills, while concerning, we're going to keep an eye on them and make sure that kids and families are able to get the care and services they need moving forward. And we continue to lift up the great work that our public health workforce is doing. So let's see, Stuart, are there any other bills that you want to mention or that I forgot?
No, I think that is it for the bills that I wanted to talk about, but thank you all for joining.